Hello, we are the Gold Diggers, Joshua Markowitz, Maren Jorgensen, Maddie Mills, and Mark Coe. This is our leadership presentation, Worth the Wait. Emergency department crowding in the United States has become so severe that the Institute of Medicine calls it a national epidemic. Patients seeking treatment in emergency departments have faced increasingly long average wait times and emergency department visit lengths over the past decade. Every day, hospital emergency departments serve as the entry point into healthcare for Americans who don't feel well and have nowhere else to go, or who have an emergency. Emergency rooms face a Herculean task. They are asked to be prepared for anything and everything while keeping wait times down and costs low. Due to EMTALA, the Emergency Medical Treatment and Labor Act, emergency rooms are mandated by law to treat and stabilize anyone who walks in the door regardless of their ability to pay, a burden that no other part of the healthcare system faces. The Shands Emergency Department has the reputation of being the best hospital in Florida while treating the most patients. However, it is also notorious for having some of the longest wait times. With over 60,000 patients seen every year, this level of inefficiency is detrimental to the community and reputation of the hospital. Shands Emergency Room has a rating of 1.8 stars on Google Reviews. Many reviews talk of extremely long wait times, rude staff, unclean conditions, not enough staff or bedding, and high rates of patients leaving before actually receiving treatment. When compared to state and national data, UF Shands has longer wait times before a patient is sent home, a higher percentage of patients leaving before being seen, a longer time before admission, and longer transfer times. A lot of these deficits stem from understaffing and poor organization of the emergency department. With less staff to admit and screen patients, the ER wait room becomes overcrowded with patients, which ultimately leads to longer wait times. Long wait times are more than just an inconvenience to patients. Prolonged wait times in the emergency room have profound effects on patients' behaviors and health outcomes. One of the biggest contributors and consequences of long ER wait times is overcrowding. Especially in the COVID-19 era, overcrowding can lead to the spread of illness to other patients in the waiting room, as well as an increased risk of death or adverse events. Overcrowding can also reduce quality of care and increase medical error due to the inability of staff to adhere to guideline recommended treatment. Prolonged wait time and length of visit also decreases patient satisfaction, which can cause patients to leave before being seen. Although often overlooked, long ER wait times have financial implications as well. Emergency departments experience a tremendous financial loss when patients leave the waiting room. Each one of these patients represent about $600 to $800 in lost revenue to the hospital. If you consider that 5% of UF Shands, over 60,000 patients leave before being seen. That's over $2.5 million lost in revenue every year. Similarly, the patient also pays for long wait times. Because so many illnesses are time dependent, waiting for care can cause a patient's health to deteriorate further, thus requiring more resources, time in the hospital, or specialized care. All of these factors lead to a more expensive medical bill. This is especially true if the patient leaves the waiting room before being seen by a physician.
Another contributing factor unique to UF Shands relates to its high ranking and reputation. Because UF Shands is ranked as the best hospital in Florida, patients come from far and wide to receive quality treatment. With such a large influx of people coming from all over the state, along with regular community members, Shands Hospital experiences a high patient volume. At UF Health Shands Hospital, the median time to be seen from the waiting room is 33 minutes. That's twice the recommended 15-minute wait time. However, a patient's wait time largely depends on their acuity. The triage process is used by hospital staff to determine which groups of patients should first receive treatment and care services based on their clinical status, their prognosis, and the available resources. Patients with high acuity and urgent symptoms, like serious and time sensitive illnesses or major injuries, can often see a provider before a patient with a less serious illness. Triage nurses determine this acuity and rank the patient according to their symptoms and past medical history on a 1 to 5 scale, with 1 being resuscitation level, which is usually reserved for traumas and stroke alerts, and 5 being non urgent, for those that could be treated by a primary care provider. Depending on patient volume for that specific day, patients can wait up to 10 hours to get a room in the emergency department. Of note, due to EMTALA, ERs are not allowed to give out wait times, as there should be no information distributed that deters a patient from receiving emergency care. Patients may show up to the ER and leave after viewing the amount of patients in the waiting room, only to call EMS in the hopes of coming back and being seen faster. However, if they are not high acuity, they'll be sent to the waiting room to face the prolonged wait time and the delay of treatment. In fact, many of the patients waiting to receive treatment in the ER have lower acuity injuries or symptoms. This causes a delay in care for patients with urgent medical issues and even those with medical emergencies that require immediate care. The CDC reported that for patients judged by the triage nurse to be critical, over 10% of these patients waited more than an hour to see a physician. This is important to note, as many emergent illnesses are time dependent. Not receiving care in a certain time frame can be detrimental to one's health. Although conceptualized to decrease patient wait time, it's clear that this existing triage model is not being optimally implemented. One of the most startling problems associated with prolonged ER wait times is the likelihood of patients leaving the hospital against medical advice. This is one area Shan's emergency department particularly struggles with. The percentage of patients leaving the emergency department prematurely or without even being seen by a physician is much higher than the state and national average. Community Regional Medical Center in California also noted this trend in their emergency rooms. In response to this observation, Community Regional Medical Center implemented the Provider at Triage program. We were interested in exploring this new triaging system and determining whether it could address UF Health Shands Hospital's long wait times and improve patient outcomes.
In an effort to combat ED overcrowding and mitigate the risk of adverse outcomes, various solutions have been proposed, including triage protocols, fast-track implementation, and the rise of urgent care centers. A key area of interest has particularly been the investigation into the use of advanced providers in triage to help improve ED throughput and minimize patient risk exposure. Community Regional Medical Center in California recently instituted the Provider at Triage program in their emergency department. This program stations caregivers in lobby areas with patients. This program was put in place to reduce the number of patients leaving against medical advice, leaving without being seen, and patients who leave during treatment. By having healthcare professionals stationed in waiting room lobbies, patients are seen within 5 minutes of entry by a qualified nurse and within 30 minutes by a provider. This system ranks the importance of seeing a patient just below that of a cardiac arrest. To prevent AMA, left without being seen, and left during treatment, protocols were put into place. Patients who plan on leaving the emergency room are first assessed if they are in a proper mental state to refuse medical care. Following this assessment, family and friends, if present, are involved in the decision. If a patient is still considering leaving, the provider will explain the treatment for a patient's chief complaint. If all else fails and the patient still wants to leave, then a speedy follow-up care is administered. This new triage system should effectively lower ER encounters where patients leave too soon. Although not implemented at Community Regional Medical Center, the inclusion of technology could further improve the effectiveness of the Provider at Triage program. Merging telehealth and new triage programs is especially relevant in the COVID era. Healthcare leaders and providers are considering how and where telehealth can replace or assist traditional modes of healthcare delivery. Patients who insist on leaving the emergency department can be presented with the option of a virtual bed. A virtual bed is essentially a program where physicians and nurses provide care via video visits and remote monitoring of all vital signs. The benefits of this telehealth measure is twofold. It allows the patient to still receive care while in the comfort of their home and bypasses the long ER wait times. One other solution that has been implemented by some communities is opening up urgent care centers. UF itself has opened up a few urgent care centers within Gainesville. By opening up more urgent care centers, patients with less severe or urgent health issues can be drawn away from the emergency room. One huge problem for emergency rooms is the sheer number of people who come in for anything from a mild fever to a life-threatening injury. The number of people then pile up, and those with non-life-threatening issues have to wait longer and longer. Urgent care centers focus on the people with those small issues like flu-like symptoms, small fractures, or dislocations. Once those people with less serious issues are drawn away, the emergency room opens up to allow for more people with life-threatening issues to be addressed. This helps to reduce wait times and people leaving the emergency room, but also requires
The provider at triage system has proved effective for Community Regional Hospital Medical Center. Our team believes this new triaging system could address many of the factors that contribute to high volume of patients leaving against medical advice and or leaving before being seen at UF Health Shands Hospital. Before the implementation of the provider at triage system, 9% of Community Regional Hospital ER encounters ended with a patient leaving too soon. This is 3 times the statewide rate. After implementation of the new triage system, fewer than 2% of patients left against medical advice or abruptly discontinued care. As of 2019, the rate of patients leaving the ER without being seen at UF Health Shands Hospital was 5%, among the highest rate in the state. By implementing a similar triage system, Florida's #1 hospital could potentially lower the number of patients leaving against medical advice and leaving before being seen, thereby increasing patient satisfaction and hospital revenue, while likely improving patient outcome. The increased financial benefit stems from the fact that more patients generate more revenue. For example, if an emergency department normally receives 75,000 patients per year and reduces the amount of patients who leave by 2%, that correlates to an extra 1,400 patients a year. At an average of $600 per patient, this translates to over $500,000 of revenue every year that was originally lost. The new triage system sorts patients based on severity of illness or tolerance for waiting for treatment far better than previous triage systems. This new system also allows the emergency department to predict how many beds are necessary based on each patient's severity of illness. Improvements to the system include uncoupling of the triage registration process and ensuring the triage process has an appropriate number of physicians and nurses for every hour of the day relative to demand. We could also improve the system by incorporating virtual beds. Patients who insist on leaving the emergency department can be offered a virtual bed where physicians and nurses will provide care via telemedicine visits and remote monitoring of vital signs. While this doesn't sound ideal at first, it would greatly reduce the number of patients leaving against medical advice without being seen or during treatment. It also provides a new method of healthcare delivery that is more flexible for the patient population. In times when a high volume of people or the population are sick, traditional modes of healthcare delivery would not be able to supply the growing demand. This can threaten the health and safety of patients and hospital staff. We have seen the growth in telemedicine following the COVID pandemic. This trend towards virtual health care should be also utilized in the triaging process.